Discovery House is a mental health adult rehabilitation unit. We provide a specialist rehabilitation service for both males and females for those individuals who have previously found it very difficult to move on through services to live an independent lifestyle. We officially opened Discovery House at the end of January 2012 after several years of planning the service. We prided ourselves in planning the service, working in partnership with our service users, clinical teams, our local community and our families and carers. Discovery House has been designed to be a state-of-the-art building to provide modern mental health services. We've incorporated lots of light and colour into the design, lots of open spaces where people feel that they can recover in. All of our rooms that service users use are ligature-free and all of our bedrooms are en suite. A good rehabilitation service provides hope and recovery for people, that they will get better, they will live an independent life again in the community.
The Fens offers a service to male clients who have a diagnosis of severe and/or an enduring mental illness. Alongside of that, they may have a personality disorder, dual diagnosis or learning disability. Because the Fens is a locked ward, they are obviously restricted by the Mental Health Act or Home Office restrictions. People that come to the Fens are deemed to be at risk if they lived in a community setting or in an open ward.
The Wolds ward is a 15-bedded mixed ward, mixed gender, open ward. It caters for patients going through a slow stream rehabilitation process, still a high level of need, but probably high level of risk at times. But the role is for us is to try and promote independence and get back into the community.
The ward is a locked ward and it's for people who are currently suffering a variety of different diagnoses. Primarily we see everything ranging from personality disorder to psychosis and everything in between, but actually which has a rehab potential. So that doesn't mean we're taking people in the acute phase, we're taking people who've just actually gone beyond the acute phase and are now ready to take that next step for rehabilitation. I think the main advantage of the ward, the Vales, is that it currently provides a service which until very recently, until January of this year, was unavailable within Lincolnshire. And it's hard to think that 50% of the population didn't have the facilities that are currently available to them, which meant that they had to go out of county. And we've now brought them back to a position where they're far more localised with their outside support networks.
The day starts about 7 to 7:30 when each individual is given a call. If they require help with the personal grooming or tidying the rooms, then the staff will go in. Breakfast is anywhere between 8:15 and 9 o'clock, and then the whole day really starts at 9 because there's a huge community meeting where everybody's joining together and that's where things are negotiated. So the whole day is then planned with service users and staff having a say in what happens for that day. Throughout the day, in the morning there's usually 2 activities which service users will partake in, and in the afternoon again there's 2 activities. And then some service users will then cook for the rest of the service users, and then at tea we all sit down and have tea. So it's a really busy, quite structured day.
Rehabilitation is just one aspect of recovery, and I think within that the idea is that we're trying to rebuild people's skills and to develop their life skills. So occupational therapists work very closely with the multidisciplinary team in order to promote all those skill-based learning tasks and to help them to develop into their future aspirations. So in terms of rehabilitation, the idea of the occupational therapist is to work very closely with them to develop a meaningful and a purposeful kind of outcome measure, something that they can aim for to promote that kind of hope and optimism and to develop skills and confidence. The activities and the interventions are very varied, and they go from simple tasks such as helping somebody to make the bed and to do some ironing through to more complex tasks such as returning somebody to work or into the voluntary sector. Day-to-day kind of running is the guys have the opportunity to engage in activities that are creative, so things such as art-based workshops, music or drama. We work on skill-based things, and we do lots of cooking. They're now kind of independently cooking to develop their skills. It's all kind of activities that will ultimately enable them to live a more independent lifestyle. We do lots of budgeting work with them. We run games and workshop-based things that they can actually get some leisure and some enjoyment out of, as well as doing outdoor activities such as gardening, cycling, bowling, activities such as that.
I also think it's really important to look at all sorts of options for people and be really innovative and creative in a way in which you can provide interventions for people that will promote healing. For example, we have pets at Discovery House. We have a rabbit called Flinders on the Fens who is very, very loved by everybody on the ward. But I think in particular it's about what Flinders brings as pet therapy. There was one day when I heard a service user on there say, when I'm having a bad day, I'll pick up Flinders and I'll have a cuddle with him and he melts my depression away. And that's real sound evidence to support having pets in mental health units. In the main entrance in Discovery House, we have our own cafe. The cafe is managed by a local social enterprise and it provides training opportunities for our service users to gain vocational experience. We have also opened our cafe to the general public recently. We're very keen to promote our services within the local community and build a relationship with our neighbours. And this also provides an opportunity to really focus on reducing stigma in mental illness.
I was a resident here for nearly 7 months, and I got put in here because I went over the rails, and I first went into Donington ward and I moved in here when it was brand new. Like, well, it did me the world of good. Like, and you know, if you was in the same situation I was, I recommend it. Because now I look back, I can think, well, it has done me good.